I'm Alice Creasy. I'm the creator of the Fertility Answers community and the app. We love bringing you these Ask Us Anything Fertility Tip Tuesdays, and Raquel is so good at them. I kind of have to tell you, you're Miss Popular on the internet.
Oh,
I know, you
that's
are.
awesome.
I totaled up the total views. I don't remember how many you specifically have gotten, but you probably have, I mean, you have millions of all the content that we've created together. I
Whoa, that's
know.
amazing.
I know. And I'm like, oh, people really dig you.
Well,
But
thank you. I appreciate it.
I think there's two things, right? Number one, I think that you bring a content perspective that we haven't heard before because you're bringing this naturopathic fertility lens to the table. And then two, you have the most amazing, unique way of speaking in a language that we can all understand.
That's true. Thank you. I really appreciate it.
You're
Thank you.
welcome. Well, we appreciate your time and giving us all this access to good information and education. All right, everybody. So, quick reminder that you can truly ask anything, and if it's off limits for what Dr. Raquel has studied, she will punt it to Dr. Chen's show on Monday or to our OBGYN, Dr. Sherry. So, the first question coming in: Journey to Miracles. Does human growth hormone help for low AMH?
That's definitely a Dr. Chen question.
Yes, and I will say that it already sounds a little controversial.
Yeah.
Because we haven't talked about it before.
Yeah. And you have to be so careful because it seems like a hormone, like, of course this will work for that. But you always have to think about the downstream effects whenever you're working on a hormone that's sent down from the brain. You have to be super careful on how it's given and for what system.
That's okay. That's a really good point. I want to dive into that for a sec, but I do want to give a shout out to Dr. Setgorn. Lucky, hi. Lucky's going to be joining us too. She's another IVF doctor that we love. And so Dr. Setgorn, earmark that. The question is about human growth hormone supporting AMH. And I don't recall ever seeing a study on that. So definitely it's a question that we want to kind of put a pinhole in. We can ask it on the Fertility Answers app too, but in particular, I want to make note of it so that we can look up the data and see if any studies have been looked at for that. So Raquel, I do want a follow-up question on that though, because you talked about downstream. So let's break that down a little bit more simple for what does downstream really mean? Yes. And what are all the things that we have to be concerned about when it comes to that concept?
Yes. So something that I feel like I thought was common knowledge, but I find myself explaining it quite often is, let's just say, for instance, FSH or follicle stimulating hormone, which is something you hear often. It's actually sent down from your hypothalamus. So it's sent down from your brain to tell your ovaries to release the follicle every month. So that's a downstream effect. So whenever doctors are looking at if your FSH, and if it is, we typically like to see it below 10. So oftentimes if doctors are looking at your labs, they may read your labs really fast because of their experience. So they're able to say, oh, immediately, maybe there's premature ovarian failure, maybe you have advanced maternal age. So they know why these numbers look that way, but it's not just a marker that only tells you about your ovaries, about your reproductive health. It's actually more telling you, you want to make sure that your brain is actually communicating with your ovaries every month, because all of these hormones are sent down from our brain. Our FSH, our LH, all of these things are coming from like this primary signal and being sent down.
Okay, that's super interesting because of AMH is really released from the follicles. Exactly. It's not the downstream one, right? And so then when she's asking about something like human growth hormone, that makes me scratch my head and go, probably not. I mean, if anything, it might, probably not. I'll just leave it at that, but we will dive into it a little bit more because I do want to look at the research, but you know, the follicles that you have, and then, you know, we don't use human growth hormone to stimulate the follicles, right? So my logical reasoning would be, you know, it's usually the traditional hormones that, you know, the sex hormones that we use to manipulate super ovulation.
Right.
Okay.
Yeah, no, exactly.
All right. Excellent. So that's a good question though. And she's asking like, what's the deal? I don't know. What's the deal with human growth hormone? I don't know, Journey to Miracles, but it's not something that I've heard of being used for AMH, to impact AMH, because you're born with all the eggs that you're ever going to have,
Mhm.
and you don't make new ones. And so I don't know if the question is coming up because someone suggested that it could help you grow the follicles that you already have into mature eggs or not. So I think that there's probably a little bit more to the question that I'm not super clear on just yet, but I'll do some digging to see if there's some misinformation out there that's raising this question, or if maybe there was a study that was conducted and we just haven't heard about it yet,
Yeah.
which is also possible. Vintage modern event planning. That sounds so fun. I'm seeing like a barn wedding with that, with like a very modern feel inside. She's 2 weeks from her FET. Should I know specific information, tips going into that? Oh my gosh, so exciting. I'm going to do a second FET later this year. So that's so great. I mean, you're great at this part though, Raquel, like teeing people up for what to expect. And it's good that she's not 2 nights before the FET, because 2 weeks, she has a chance to like get some good practices in place, right?
Yeah, I know, especially like with patients I had in the past, this is typically a time where they up their acupuncture. So if they're already getting acupuncture like once a week, I know oftentimes a lot of these acupuncturists will up it to 2 or 3 times a week, and mostly because of how it helps us to like better regulate our stress response.
Yes.
And even some acupuncturists who they work with patients who had like implantation failure as well.
Right.
So I would definitely say like employing some of those practices that will help your body naturally regulate like stress hormone, inflammation, not introducing anything too abrupt 2 weeks before, but really just supporting your body as you prepare for your eggs.
Yeah, no cleanses right now. Don't embark on any cleanses.
No.
Everything should be supportive and nurturing and loving. And like I would be, drinking a lot of bone broth and what about
amazing.
What about eating beets? It's a blood builder, right? So for the uterine lining, I don't know if there's any research on it, but I mean, sort of conceptually, it's a blood builder, right? So beets would be a good choice if you like. Beets. My son loves beets. We eat a lot of beets in my house.
Dante is like the healthiest kid I've ever met in my life.
He's also eaten
so healthy.
eight meals by 3 p.m. today. So he's going to wake up and be 5 feet tall tomorrow. And for those of you who don't know, Dante is my IVF miracle. So he was a frozen day 2 embryo for 5 years. And now he's 7. And, which is just wild.
I think
lots of self-care.
Amazing.
Beets,
any especially those healthy fats, anything that would improve blood flow, like a really good omega-3 would be an amazing thing if you're not already taking it to maybe start.
Yeah, now's the time to eat, salmon, right? Because you might not be in the mood for it in first trimester.
Yeah, exactly.
So eat it before the FET, but this is super exciting. Keep us posted on how it goes. So let's see. S. Fergal, well, we just started, Dante. S. Fergal is asking perfect size of a follicle to trigger for an IUI. So we might want to punt that to Dr. Chen's. We did, because there was a glitch with technology, love. Let's ask that question. S. Fergal, ask that question either on the Fertility Answers app or just, I think I have a Thursday show this week at 3 p.m. Pacific. And you can ask Anna from Barbados IVF that same question too. Otherwise, wait till Monday when Dr. Chen is back on. But if this is urgent, just hop on the app. 75% of questions are answered within 24 hours. And we're working to get that to 95% of all questions answered within 24 hours. And it's all people that are answering for free. So just everybody keep that in mind when you do ask a question. We do rely on free board certified professionals to get your questions answered. That's one mean, funny handle. That's one mean girl. I love handles. They're so fun. So asking, does irregular periods prevent you from getting pregnant?
Does irregular periods prevent you from getting pregnant? That's a good question. I always like to say, when it comes to periods, what we really want to focus on is ovulation. Sometimes irregular periods could mean that you are not ovulating. However, the better predictor that you will have problems with fertility is seeing whether or not you're ovulating. And so periods are important, but you want to make sure that as you're tracking your cycle, you're using different things like UVA. I know you really like UVA or the AVA bracelet, or whatever the case may be. You want to make sure that not only are you having a regular or versus irregular period, but that you're really seeing, is my body actually releasing this egg every single month? That's
got it.
Important. Yeah.
Okay, that's incredible. Okay, that's very helpful. And this is tough data to get because we're not always set up to like run into the clinic at the right time of our cycle to have somebody do a scan to see if we released a follicle or to do a blood draw to see what our progesterone level is.
Yeah.
But you're right about the data. You know, sometimes Serena tries to say to people like, just have sex twice a week, you know, for a whole year. And if you have irregular periods, get a complete workup so we can rule out, you know, any sort of cause of that, right? Although sometimes it could just be a missed one here and there for stress reasons or what have you. But I do personally love data. I love I love my Apple Watch. I love my Peloton tracking. I love those things. So any kind of gadget to gather data around my own self at home is to me very valuable.
Yeah, I completely agree. And to me, it also teaches you about your body.
Yes.
In a way you probably didn't even pay attention to before. You know,
exactly.
I always ask like a lot of like patients that I work with, like, what do you notice about your body when you're ovulating? And a lot of cis women or a lot of women will just say like, I don't know. I never paid attention to that. And then when you do start paying attention, it's like, oh my, I'm like warmer.
I know.
Like my is thicker. But if you don't like think about it,
sex drive goes up.
Even the opposite sex is like more attracted to you if that's your thing, if you're into that.
Right.
Or your partner may be more attracted to you. But those are things that you have to like really pay attention to during those times.
I agree. There is no downside to noticing your own ebbs and flows throughout your cycle. You know, and I think it opens up a path for us to be kinder to ourselves too. Like, oh, why am I craving that thing? And instead of beating ourselves up, it's like, oh, because that's just where I am in my cycle. Exactly. I had the buttered popcorn on the couch last night for dinner and a glass of wine. And who cares? I made that my dinner, and you don't have to feel bad about it. Yeah. You know, it's sort of like honoring, I think, those natural rhythms and not making a big to do out of them, but noticing and kind of loving the uniqueness of each individual self.
Yeah, exactly.
Dr. A.M. Nunez just saying hi from Las Vegas. Hello. Glad to have you join us. Let's see some other questions coming down here. How many days or weeks before an FAT should you start doing acupuncture? So that's a great question.
That's a great question. I know some REIs work specifically with acupuncturists, but in my personal opinion, the best thing to do is coordinate it with your fertility cycle or your IVF cycle, IUI cycle, to really make sure that it's in sync. So as soon as you start your protocol, it would be ideal to start as soon as you start your protocol because they're able to time it with the doctor.
Yes.
Like, this is when everything will be taking place. And sometimes they even change the points to fit your specific protocol. So it would be ideal to start it either before or right at the start of your protocol.
Right. And the other thing to keep in mind too, Muriel Rousseau, for this is there's so many acupuncturists who specialize in fertility, and they're often educating the fertility doctors who are willing to listen and willing to coordinate and willing to work, you know, very side by side. So I would also just encourage you, you know, to reach out to a couple of acupuncturists in your area. If you don't have any, we have a wonderful network of professionals. Through the Fertility Answers app, you have access to free fertility advocates who through just text chat will find out where you are, what you're looking for, and they can help navigate you to the right place. So hopefully that helps too. And I did acupuncture, I think, almost throughout my entire pregnancy. So because it was helping me with all the side effects of pregnancy, just with nausea and anxiety and other things. So there all are safe points throughout the pregnancy. So for the question of like how long after FET should you continue it, there are wellness protocols and wellness points that you know that these acupuncturists know very well. So it's not contraindicated in pregnancy. Is kind of my point. Olivia. So unfortunately went through a miscarriage in November. Very sorry to hear that. And the first thing we always just advocate for, Olivia, is making sure that you're emotionally being taken care of. If you are connecting with a grief therapist, if you're connecting with a psychologist, if you have connected to other women who have also gone through this. I had 5 losses myself. And it's something that just, there's no time frame for when you're going to stop being triggered and when you're going to get over it and all those other, crazy things people say. Now, physiologically, she has had heavy blood clots since then. And she's also doing IVF. She's hoping to do another transfer, but should she be worried about the blood clots?
That's a really good question for your specific REI. I would definitely, I'm pretty sure they do a transvaginal ultrasound every time you go in. But if not, if you haven't started the IVF cycle yet, I would recommend bringing this up to your doctor and letting them know that you're interested in getting a transvaginal ultrasound for them to just make sure everything looks okay. There's no structural abnormalities. There's no tissue left behind. Because that's what it sounds like. But I would definitely ask your specific REI to really do like a deep dive to look, inside of your uterus and see what's going on.
Yeah. And I can tell you with 100% assurance, Dr. Chen would agree with that answer, Olivia. And she would say it has to be a water sonogram because they like to at least at a minimum do a water sonogram because it does kind of wash any remaining clots or tissue behind. So I think that that's an important consideration and that's her standard of care just to make sure. Yeah. Okay. But we're really sorry that you had a loss.
Yeah.
You're welcome, Journey to Miracles. I'm glad you found it helpful. KC Legs, are there any tips for the 2-week wait after transfer? So that second one. So yeah, I would go ahead and this is the time. So Casey Legs came on probably after we answered that question before. Let's reiterate it for any newcomers that just hopped on. The 2-week wait is the same as the 2 weeks leading up to really an FET. It's the perfect time for a ton of self-care.
Yes.
Just a lot of nourishing goodness to yourself because it can be filled with a ton of anxiety. Our brains can be runaway freight trains. We're almost looking at too much into our body at that point. Like we where we analyze every single solitary thing that we're feeling. We analyze if we're not feeling anything. So we just advocate for a lot of self-care. Is there anything in particular that you really like that you've seen even in your patient population, Raquel, that they do during the 2-week wait? Any good ideas?
One thing that I really like is journaling.
Good idea.
Yeah, I have seen really, really just really good results, not even in just achieving pregnancy, but what it does to you mentally, because it really helps you to get some of those negative spiraling thoughts out of your head and onto paper. And it helps you to just be more present for those 2 weeks. So I think journaling, meditation are amazing ways.
I love that advice. I did find a journal that I was journaling in and I was writing letters to Dante, but I didn't know his name was Dante at the time. And so now he has those kind of forever, and you don't know how long it's going to take until you finally get to hold your baby in your arms. And when I started that process, I didn't know, how long it was going to take. And that includes years before I had him, when I had my first pregnancy loss, and journaling to the future baby. And it took years for Dante to show up, and it was always supposed to be him. Always. Yeah.
Mm-hmm.
Yeah. Journaling. Great.
That's so special.
Oh, good. And Dr. Sekhorn piped in. She said, not a proponent of the growth hormone use. Okay. We'll do a whole breakdown of that. Dr. Sekhorn.
Yeah.
Do Sekhorn when we get to do
that would be awesome.
Together. Yeah.
That would be awesome.
I accidentally said her name with an R. Sorry about that. Okay. Let's see what else. Curious about it for poor egg quality. Yeah. It doesn't change egg quality is what Dr. Sekhorn is saying. So listen to Lucky. She knows what she's talking about. Okay. And there's a lot of things get picked up like that. It's like, a clinic reported using on 15 patients and said that it worked, but there's no, that's not a study. And then all of a sudden people start talking about it on social and it gets confusing because we want every little bit of glimmer of hope that we can get. Right. I think that's part of it.
Yeah.
Venusa Pontini, her transfers tomorrow. Exciting. Endometrium is 15.9, embryos 4 BC. What percentage will work is going to be a Dr. Chen or a Lucky question. That's a Serena or a Lucky question. So we'll save that. If you want to ask that on the app, try to squeeze in kind of the percentage. Although I will say this close to your transfer, I will discourage you from thinking about what percentage chance. I will encourage you to just focus on kind of like love, focus on just, making sure that you're loving you, that you're grateful for your body, what it's produced well for you, that you have an embryo to transfer at all, that your lining is good, that you have a cushy environment, and try to kind of maintain that positive frame of reference or positive mental attitude rather than focusing too much on percentages. The percentages tend to play tricks on us, and that starts up spiraling thoughts, maybe journal tonight and focus on if that embryo has all the ingredients to keep growing, don't even focus on the BC part. Don't focus on anything about the embryo. You have an embryo to transfer. That's the most important thing.
Right.
Okay. Jessica, PCOS. I love PCOS questions when it comes to you, Raquel. Doesn't really ovulate, was just informed her husband had a sperm analysis, which also came back abnormal. So first, we're sorry to hear for kind of a double whammy. But we have a whole show on metformin for fertility. We have whole shows on Clomid. So talk her through the naturopathic perspective first on how you would approach maybe reversing the symptoms of PCOS in her case and kind of, cleaning up her own wellness to see if first lifestyle changes can make a difference.
Yeah, absolutely. So when it comes to PCOS, we always hear that these women actually have anovulation. So they're not ovulating or they're having irregular menstrual cycles. That's very common. But a big part of the piece that I always like to focus on is beyond like just the basic markers, really looking at your hemoglobin A1C. Because what happens is if your hemoglobin A1C is elevated, you are really going to have a tough time not only having a balance of hormones, but your ability to implant an embryo is also severely decreased. So whenever I have a couple or a woman that has PCOS, I always first try to make sure, okay, what are your hemoglobin A1C levels? I also like to look at inflammation. So that could be through, through CRP, if you don't have like money for advanced testing. But insulin and inflammation are huge underlying factors for PCOS and why these women struggle to conceive for so long. And that's where I like to start. Sometimes metformin is indicated. If your hemoglobin A1C is too high, you don't want to continue to try to use like natural sources to bring down your insulin levels. You want to instead listen to your doctor, listen to your provider to really bring the levels down. Now, once your levels get into a good range, now we can get more into the chromium. Now we can talk about some of the other things to naturally bring down your insulin levels, but first they have to get into that healthy range.
Okay.
I always like to focus on, improving insulin sensitivity, which is amazing through things like chromium, even exercise. So when we exercise our large skeletal muscles, especially in our legs, will help us to better dispose of that excess glucose.
I didn't know that. Cool.
Yeah.
All right. Riding that Peloton.
Oh, Peloton. Amazing. That's an amazing way. So always, number one, like you said, I encourage improving insulin sensitivity, sometimes through meds, and then oftentimes through natural like nutraceuticals, and then also exercise. And then a really, really important piece is making sure that you have a diet that is nutrient dense. And that's a tough part. Compliance is a really, really hard part, but I promise you, in the patients that are compliant, they really understand, I really want to conceive, this is something I want to do. When you really pay attention to what you're eating, if it's keto, Whole30, whatever the case may be, just making sure that you really are having vegetables, vegetables that have like a really good amount of DIM, which are going to be like your dark leafy vegetables, because this will help you to like push out excess estrogen, things like that. So really cleaning up the diet, improving insulin sensitivity, and encouraging exercise are like my staples.
I love that. That chromium, when you said that a couple of weeks ago, I was like, oh my gosh, that was the first time I had heard that. We talk about PCOS all the time.
Oh, yeah.
So I'm so excited about chromium. Are there foods that are rich in chromium? Because I only have ever really heard about it as a supplement. So
That's a good question.
Research foods that maybe have chromium, right? We should research
that. I have this on my computer because I talk about this a lot.
Okay. And as you're looking that up, I'll tell you one of my favorite dark greens that I didn't really know I was ever going to love, because I just never occurred to me to saute it in like a little coconut oil, are the beet greens, since I've already brought up beets. Beet greens, oh yummy. So don't get the ones that are already, with the leaf torn off. Get the ones with the leaf, chop them up. It's so delicious.
Oh, that sounds amazing.
Coconut oil. Mm-hmm.
So foods that are foods that are high in chromium are onions, tomatoes, brewer's yeast, oysters, whole grains, and bran.
Oh, interesting. Bran.
I
always think of my parents when I think of bran.
Yeah. I know. It is such it's such like an older like staple to have.
It is, right, exactly. Yeah. Now we tend to like flaxseed and
Yeah. Yeah. But it's so interesting you asked that, because I constantly like talk about this.
That's great. Okay. Well, I love onions, so that's good. So Sandoval is taking a supplement of chromium and folate. Great. We love folate for hormonal balance help. Been trying for 4 years, just started taking it Saturday morning. Hopefully it can help. So in her situation though, if she's going for hormonal balance, wouldn't she take chromium for improving insulin sensitivity, but then add in inositol for the hormone balancing?
Right.
Okay.
Yeah. Inositol is way better for hormone balancing and for an extra kick. Most people recommend, or most research recommends, taking inositol and melatonin together.
Ah, great. Yeah. Okay, interesting. So you have to take it at night because melatonin is going to help you sleep.
Yeah, exactly. Okay. Yeah, during the day.
Okay, there is a product by Fertility that Serena loves. It's called Ovasitol. So ova with finding ova with inositol. So Ovasitol. So Sandoval, if you go to Fertility with an X on the end, you'll see their product. And I don't know if it has melatonin in it, but you could always just add like a melatonin gummy, right?
Yeah.
5 milligrams is enough.
Oh, for sure.
Oh, okay.
And sometimes you might need a little less. Like some people are like, oh, I just was completely knocked out. It was hard to get up in the morning. If you ever notice that, just half.
Oh, okay. That never happens to me. I can 10 last night and I slept great.
Same. I need it. Yeah.
Although it is true that like sometimes I'll take one of Dante's kid ones. It's only 1 milligram and feel like I'm asleep like this. So I don't know. Part of it's psychosocial. It's like I took it, therefore I'm supposed to go to sleep.
Exactly. Yeah.
All right. Haramex is asking, is it safe to be part of slush nitrogen vitrification IVF process? Okay. So that's definitely going to be not even probably a Serena question. Haramex, I'm going to ask you to ask that on the Fertility Answers app, because I have a number of embryologists and lab directors that will answer that question for you about potential harm to the embryo. So, so let's actually, if you don't mind, Haramex, it's an awesome question for our community. Jasmine's asking, is there a way to keep your prolactin level good and get pregnant? Her recent blood work showed her prolactin level went up to 34. She was also put on a weight loss program. She does have PCOS.
Okay. I know for some REIs, they will recommend that you actually take a medicine to bring your prolactin down, because what happens is if your prolactin is too high, it can cause infertility. So some doctors will give bromocriptine. That's actually the most common drug that's prescribed is bromocriptine for high prolactin. Okay. But in personal experience for patients, friends, I always recommend Vitex. You can even look at the literature. The research even shows how effective Vitex is in really bringing down prolactin, and it's because it really works on that like hypothalamic pituitary axis.
Okay.
So Vitex is excellent.
Vitex, okay.
Vitex.
And it doesn't need a prescription. It can be over the
counter. It's a supplement. It's
okay, great.
It's chase tree berry.
Okay.
Yeah. Great. So it's a supplement, but it's excellent for sure. But always run these things by your REI, your doctor, to make sure it's okay.
Okay, excellent. Is there a tie-in between prolactin levels rising and weight gain?
That's interesting. Not sure.
Okay.
But some people have a prolactinoma.
Right.
Which is like a tumor. Yeah. But then sometimes
and it can happen for men and women.
Right. Mm-hmm.
Okay, got it.
Yeah.
So Lucky's also further clarifying. I kind of like having an REI in our audience right now to clarify some of these questions. It's kind of perfect, right, to round out, to allow multi-panel on these lives. So saying the human growth hormone has been used to try and improve response to stim. So that's interesting. So that's not directly related to like your AMH level, but to see if you have more follicles, maybe, a broader cohort of eggs through a stimulation process. But if she is not a fan, I'd say, I mean, she's with RMA New York, very well-researched network of clinics. So I would say heed that advice, and if we're not seeing great data on it, but for that user who is asking journey to fertility, I will definitely think that was her handle. We will definitely still, do our research just so that we can take an independent third-party look, and you can always check back in with us, and we'll let you know what we found out too. A lot of times they are like super small studies, and people try. Kayla is asking, just had a DNC after losing her baby at 9 weeks. Oh God.
Sorry about that.
You punched me in the gut. Got pregnant taking progesterone and Clomid. So how long to wait again until they try for the rainbow baby?
So most research states that you should wait a full month, 30 days. However, you should specifically ask your REI, or if you've been going to OB-GYN instead, you want to ask them what they think as well. Some will recommend 30 days, some will recommend 2 full cycles. But it's best to ask your doctor what they recommend, and to also do, again, some type of imaging. It can be transvaginal ultrasound, saline, whatever the case may be, but to just make sure there's no remaining tissue. Yeah, exactly.
And we're so sorry. And sort of, we have an emotional support program that we work with called Organic Conceptions, Kayla. They have kind of a very well-researched 9-step process for people who are going through really the crisis of infertility. And, quite a few of their early members have also had pregnancy losses. So I just encourage you to take a look at that, if that could be something that's supportive. I do hope that you're getting proper therapeutic care, so that you give yourself space and time to grieve. And I feel like sometimes you try to jump into like the next cycle, and then we get triggered, kind of even by going through the process. And then all of a sudden we have these anxieties, and it really does help a lot to kind of acknowledge all of that with, with a therapist, with somebody who specializes in our field. And there's so many great ones out there. Yeah. If you're in California, we work with a fabulous team. For New York, we know where to send you. If you don't know where to turn, just get in touch with us through our DMs, or respond to one of the text messages that my team would have sent you as a Fertility Answers app user, and we can find somebody for you. Jessica's follow-up. Her husband's abnormal sperm. We have to address that. Supplements.
Oh, yeah. So number one, I would just make sure that the andrologist or the REI specifically states what is abnormal about the sperm. Sometimes there is another referral that may be needed to a reproductive urologist. But if it's something that the andrologist feels like, okay, there's just a slight abnormality or low volume concentration, I would recommend antioxidant support, which I think is amazing.
Yes.
For men, it takes about 120 days to form new sperm. And so in that case, I would recommend, if you have access to IV therapy or IV glutathione push, or if you're not into IVs, just getting a really good male supplement that has, even if it's just zinc, It could be zinc alone or vitamin C. Having these antioxidants are key for improving male sperm.
So to speak to her IV therapy, so Raquel and I are both huge proponents of getting some really nourishing vitamins through intravenously. And this is something that has popped up truly all over the world, made popular in some part by the Myers cocktail, but now there's custom blends with wellness spas kind of all over the world and integrative medicine practices. Dr. Raquel used to have her own through her clinic that she was working with. I mean, my esthetician has her own practice now for the drips. I go to a new place up here in Northern Idaho, and it's amazing. I feel like I healed myself through my chronic fatigue from having gone through 3 years of cancer treatment. I thought I would never, ever, ever wake up and feel refreshed again until I discovered these IV drips, and they're best with hydration. And the glutathione, I love. I mean, I just picture like these antioxidants entering my bloodstream and just like lighting up my body with yumminess, you know?
Right. Yeah, no.
And your skin everywhere.
I know. And your skin looks amazing. Like whenever you do it,
oh, it glows.
Yeah.
Yes.
Totally.
And you feel, I always tell people, like, I feel like there's oxygen behind my eyes when I get them done. And I get them done once a week. When I first moved up here, I was even not once a week, once a month. I was doing them twice a month because I was really struggling when I first moved. So there are some people who do it during pregnancy. I did look into that. I know not everybody does because it's not necessarily been tested, but there are some centers that I found. I think only 10 more minutes.
Look at that little hand.
Look at that little hand. That little hand that's about to triple in size tomorrow because he's eaten so much in one day. It's crazy. Oh my gosh. Okay. Lauren, who's one of our followers and community members who is so gratefully 12 weeks pregnant. Yay.
Oh, yay.
But she is having headaches. So I've been drinking water and sometimes Gatorade zero sugar. I feel like when we're pregnant, especially in that first trimester, we tend to be dehydrated without knowing it. So even if you're drinking a ton of water, it's like not necessarily absorbing all the water.
Yeah. Yeah. Even I know I think I saw it at Whole Foods. But no, just to speak about being dehydrated, you want to make sure that when you say you're drinking water, that you're paying attention to how much water you're drinking. So like she said, you may be more dehydrated than you think. So you want to make sure that whatever your body weight is, that you're having at least half of that in ounces. And sometimes that may solve the trick. I feel like oftentimes when we have a headache, we do just need to drink more water. However, if the headache is persistent, you might want to have your blood pressure checked just to make sure it's not bigger than you think. So you definitely want to have your blood pressure checked with your PCP or OB-GYN just to kind of see where you are now.
Can't she add a little bit of salt to her water too?
Yeah, that's another good way to improve
the actual absorption of it. Because I remember when I did the keto plan, I was testing our keto partner. That was in their tips and tricks of if you're feeling sluggish or you get a headache, that it can usually get rid of the headache in 15 minutes because the assumption being that it's tied to hydration.
Nice.
So that was a good, I like my little Himalayan pink sea salt. If you can put a little bit of that in there, Lauren. Also, we also add some sea minerals in ours just to again, help with the minerals and everything. But yeah, her point, Lauren, that's a really important point, the one about blood pressure, just because, there is a level of risk for preeclampsia for all of us, in any pregnancy. And the earlier that you catch maybe that going up. But it would also be good, just, your body's changing and sometimes our alignment gets off, and maybe a little bit of acupuncture back there if you have a stiff neck, and maybe you already need to wear a belly band because it's alignment or posture related, So have your partner give you some head massages and some neck massages. You get to ask for everything you want and need from now until your child is 18.
It's your world now.
It is, Lauren. It is. And you worked so hard to get here, girlfriend. So ask for what you want and need, like those. So Vintage Modern, I'm saying thank you both. Love beets. Me too. Take on drinking wine still. What's your answer to that? Because I have 3 different answers from 3 different doctors.
Wine while you're pregnant?
Well, I think trying to get pregnant.
Oh, okay. I was about to say, I can't talk about that.
Yeah, no, not during pregnancy. No. We're not in Australia, people.
I know. Yeah, I mean, I think in moderation, wine is okay. The research is super conflicting. For men, it's very clear that it directly affects sperm, but for women, there's no research to say do not have wine. So my actual answer to that is have wine in moderation. I think anytime you restrict yourself too much, it only causes more stress and affects your fertility cycle more. So in my opinion, if you are just really needing to have a glass or whatever it may be, a really cool trick that I give to my patients is to have a glass of chamomile tea and then have like your wine after.
So
you'll notice
smart.
that you probably want a little less because now you'll be like,
you're chilling out. Relax. Yeah, exactly. Yeah. I love that. Okay, that's a great idea. So Dr. Chen, so Serena always says, nope, just lay off it all. Like lay off of the alcohol. You're trying to conceive, do everything possible to abstain. But I want to invite you, Vintage Modern, to go into our IGTV with my special guest interviews and check out the interview I did with Dr. Green. He had just such a fabulous, very scientific approach to like, we sort of make wine the devil when we're trying to conceive, but there are good proven qualities that are beneficial to the body. So he, like Raquel, very similar responses. Extremism sometimes causes far more harm than sort of moderation. And it doesn't have to be, such a hard or fast, absolutely not. But Serena's, she feels much differently. Now, granted, she also takes the approach of like, don't work against me. If I'm working really hard to like have this IVF cycle be successful, I need you to do your part,
I get that.
We're in it together.
Yeah, I totally get that.
Hot Mess Mama, love that handle. I think like people's creative handles are just everything. Are the myths about pineapple after transfer true? Okay, so I love this question. I have to say, our most viewed video on YouTube and our Facebook channel and everything is when we interviewed Dr. Norian about pineapple.
Ooh, what was the outcome?
We have over like 600,000 views of this one little video that we shot with Dr. Norian from HRC Fertility. And we were addressing this because we know that it comes up all the time. In IVF, like the pineapples become a symbol. I don't really get it. There's literally never been a single study done on pineapple and fertility, not a single study.
Yeah.
But it comes up because of bromelain.
Exactly. That's what I was going to say. Yeah.
So can you break down for people like why bromelain is a good thing and how probably eating too much pineapple itself rather than maybe some bromelain in your supplement, in your quercetin supplement might make you break out in canker sores?
Right. Exactly. It's because bromelain is an anti-inflammatory nutrient. So that's why the pineapple myth is actually effective because the bromelain in pineapple actually supports your body's immune system. So your body's ability to see a trigger and actually control that inflammation is due to nutrients like bromelain. So it's kind of true, but I would say either find a supplement that has anti-inflammatory nutrients in it, including bromelain. But I think having a little pineapple is okay.
I mean, a little pineapple is great, but I feel like people OD on it and it's like super high in sugar, super high in acid. I'm not kidding about like breaking out in canker sores. If you feel tingly when you eat pineapple, there's a reason. So what they're really talking about is the bromelain. So thank you for that response, Raquel.
Of course.
All right. And Stephanie's, will I be considered a high risk pregnancy if my A1C is 108? She's trying to prevent high risk pregnancy at all costs.
If your hemoglobin AC is 108.
Mm-hmm.
I don't know if that's right. Maybe you're talking about your fasting insulin. Because hemoglobin A1C, anything above 7.0 is high.
So hers isn't a 1.
So I think you're talking about your fasting plasma glucose. So it can either be your fasting plasma glucose or your glucose right after you eat. I think that's what you're talking about. That would make more sense.
Okay.
Yeah, and that I want to say fasting plasma glucose should be below 90 or below 95. So that sounds more close to the number, because if your hemoglobin A1C is 108, that's extreme.
Yeah, so that does not sound accurate. Stephanie, I'd like to ask too, what is it about the term high risk pregnancy that you're concerned about? One thing that's actually kind of great about being considered that category is you get to see a lot more specialists throughout your pregnancy.
Yeah.
And it's kind of nice. I
was
we're gonna, these are an hour, honey, so we're almost done. We actually are on the home stretch now. Okay, thanks for hanging in there, Dante. This is a hard time of day for the little guy, or big guy actually. So one of the things just to know about that is that, you know, anybody that's 37 and older who's pregnant is automatically lumped into a high risk category. I'm going to be 45 this summer, and so I'm for sure going to be in a high risk category.
Wow, you look great.
Oh, you didn't know I was that old?
Wow, what's the tip? Give us the tip. Like, wow, you look amazing.
IV hydration and nutrients.
You look amazing.
Oh, you're so sweet. I've been trying for a year to get your quality skin. I've been working so hard on that, but I have to like reverse age.
Wow, I had no idea.
Yeah, so I'm like really on the, you know, on like the high risk category. And you know, I work out every single day. So Stephanie, you know, some of those things that Raquel was already saying that you can be doing is like daily exercise, right? Like control, you know, doing things like the chromium would be great, right? For her, if she is like inching up there and maybe having some insulin resistance, right? But I do want to hear a little bit more about like, what are you concerned about it being in that high risk category? If you're concerned, like, oh, I really want to reduce my risk of preeclampsia and things of that nature and gestational diabetes, that's great. And I think working with a naturopath like Raquel, working with an MFM can help you reduce those risks. So you know how to eat before getting pregnant to help reduce all those levels and kind of get you into like an optimal place, and how to eat during the pregnancy, which quite frankly is hard to follow if you have cravings and aversions. It is hard, but going into it mindfully and you'll be fine. You'll be good. All right, let me just, we only have 5 minutes left, everybody. Does Oklahoma City area for a good acupuncturist. Vintage Modern, just drop a DM to me and I'll get one of the girls helping on that tomorrow. We have 3 fertility advocates who can help network for you. So we can ask our acupuncturists in our network who they know in the Oklahoma City area and that kind of thing. But if anybody else in the community does have a recommendation, let us know in the comments. Okay, transfer tomorrow. Oh, we already did that one. Okay, we did the transfer tomorrow one. All right, let's see. All right, we're going to end on this one. So this is our last question. So it is Dr. Elise. I don't know how to say her handle. She's been on a couple of times. So I need you to phonetically spell that out for me. So she's not having a regular period or ovulating, and her OBGYN says her tests and ultrasounds are normal, which is frustrating because it's not normal if she's not ovulating. If she knows for sure she's not ovulating, it's not normal. So her OB-GYN shouldn't even say that.
That's weird. So she doesn't have a period and she's not ovulating, but the OB-GYN is
not a regular, right? She doesn't have a regular period. So she's like, her brain needs to tell her ovaries to ovulate. So what would you do with her as a first line of defense before she moves on to meeting with an IVF specialist, if anything, or would you just send her directly to a specialist?
Yeah, so I would send her directly to a specialist, especially if, well, let me backtrack a little. How long has this been happening? That's a really key indicator, because I think that imaging is an undervalued piece. Even if I'm working with a couple that wants to conceive naturally, there's nothing I can do if you've never had an HSG. Some people never get an HSG, but if you've been trying to conceive,
tubes are open. Remember, an HSG just makes sure that your tubes are open.
Yeah. So in this case, some people never need an HSG. Some people conceive naturally; their body, it's fine. But if you've been trying, some imaging is super important. So in this case, if it hasn't already been done, I would ask my OBGYN to really do some advanced testing because this is something that's under the purview of your doctor. So testing should be done, even if it includes some blood tests to see like what's happening. But there's something wrong. That's not
exactly.
normal.
It's not normal.
Yeah.
And Serena would be advocating for the same thing, is like, get to a specialist, because the tools in the specialist toolkit are not designed to like funnel you into IVF. They're designed to actually get to the root of the problem. And they just have more tools at their disposal than an OBGYN does. There's more diagnostics they can do. The imaging is typically higher quality. There's a lot more lab work that can be done. And then there's low tech things that you can try, moving kind of up the chain to higher tech solutions like IVF. But I would certainly suggest that, that if you have an ovulation disorder, that we should get you in for a full workup. And same offer, just drop us a DM or get on the Fertility Answers app. As soon as you register, you'll get a welcome message from my team. And it's a real human who's going to connect with you and help you navigate to find the right clinic for you. But I would not focus on, I'm going to a clinic to be sold IVF. I would focus on, I'm going to a specialist to get a complete workup, because you're not getting the correct story from your OBGYN right now.
Exactly.
32 Bravo just wanted to clarify what the A1C should be. So could you just restate the level?
So if you already have diabetes, your doctor will want it to be below 7. But for my patients that are preconception or trying to conceive, I would say anything below 6.
Okay.
Is ideal.
Got it.
Yeah.
32 Bravos had 5 failed transfers too. So I just want to acknowledge the endurance that she's already just had to muster up to go through that. But certainly, for 32 Bravo, working with finding maybe an integrative addition to her IVF team, maybe adding acupuncture, but gosh, 5 failed transfers. I'd love to connect with you, 32 Bravo, and see if there's anybody in our network who might be good to help you connect with. Okay, so we've got to wrap up because it's 4:59, but I see Vintage, you asking, about the stress levels and how to kind of cope on the emotional side. So there's 2 things, like the melatonin is a big one that Raquel has talked about a ton, and we've done a lot of episodes on melatonin to just drain your cortisol level at night while you're sleeping. And the other side, I'd love to connect directly with you, because I would like you to take a look at this Organic Conceptions. They have this fertile mindset course, and they worked with psychologists, and they defined sort of 9 distinct stages that you go through while you're coping with things like pregnancy losses like she has, and coping with infertility, coping with 5 failed transfers, coping with certain things. And it's a self-paced course. So you do it at your leisure. You can do it with your partner. You can do it without your partner. You can join the community to have conversation around it. You can get one-on-one therapy, one-on-one training, one-on-one coaching. So I think it's kind of, a really, awesome thing to do. So all these other questions, please feel free to ask them in our DMs so that we can get them in the app, or just go to the Fertility Answers app. Try to join, at the top of the hour. We're so sorry we were running a few minutes late today. Instagram changed everything and I panicked, but we figured it out. We will never let you down. And I do want, I just want to say thank you, Dr. Raquel, for giving us an hour of your time every week that you can. I know you're so busy, and you're such a gift to us and our community.
Oh, thank you. Thank you, of
course. All right, everybody.
Thank you for having me.
You're welcome. We'll see you, I think, Thursday at 3 p.m. Pacific, for Traveling for IVF, Ask Anna Anything. And next week, Monday, Tuesday, and I think a couple of extra ones in there too. So Monday, 2 p.m. Pacific, Tuesday at 4 p.m. Pacific. And we'll see you guys then. Thank you. Bye-bye, everybody.
Bye.